All right, so we're looking again at this longitudinal section of the long bone. So at the top of the long bone, at the end, these are going to be areas. This is the epiphyses. This is going to have a lot of trabecular bone here. This is the spongy bone. And then along the sides, here and here, we're going to have the compact bone. Okay. Let's see, what else we're supposed to find? The articular cartilage. So I'm going to flip this over. This is the articular cartilage here. Okay. It is nice and shiny. As I feel it, it's very, very, very smooth. So that articular cartilage here is good for motion. So when this, I don't know if this is the femur or the humerus, but when it meets the other bone to make the joint, you don't want this to be rough. You don't want it to be grinding. Okay. So this is the articular cartilage here. It is very, very smooth. It feels slippery. Kind of feels like warm ice, I guess. Nice and smooth here. Yellow marrow. We talked about that before, but I'll show it to you again. Right here. Can I move it up?
Nope, you're good.
Okay. Here's our yellow marrow again. It's nice and squishy like before. I'm not going to scoop all this out for you. But if you were an in-class person, I'd make you squish it with your finger. So this here is the yellow marrow. Again, it's white. So that's showing us that it's from a young animal. It hasn't turned yellow as it does with age. Okay, we found the cortical bone on the outsides here. Again, you can kind of see how it's more smooth and dense looking compared to the trabecular bone, which looks more splotchy or not as solid. You can see like the little spaces in between it. The perosteum, this one also has some perosteum on it. This one may be a little bit easier to peel off. So there, that one peeled off nice and easy. So here's some of the perosteum along the outside here of the bone. Okay. Again, it's super, super tough, super fibrous. Let's see, so if you can see that. Okay, the underside here. The underside of the perosteum, that contains the osteoblasts, which are going to do all the bone building. I think that was in 4.2 of your notes with the remodeling section. I don't remember exactly, but this is where the new bone cells are going to be added to, is on the outside. Okay. The osteoclasts are going to be here on the inside. And what they're going to do is they're going to clear away the old bone and create more marrow from that old bone tissue. All right, tendons and ligaments. So we do have some of those here, as well as some other kind of fat and connective tissue. So let's see. So I don't know if you can see right here. This is, it's connecting a bone to something. I'm not sure if it's connected to another muscle or another bone. I don't know what it was connected to. But if you look at this, I don't know if you can see the fibers, how they're going in a nice line. They're all going the same direction. So the fibers here are parallel. So this is going to be an example of the dense regular connective tissue, which makes up the tendons and ligaments. These are going to allow this bone to move in one direction. They have a lot of collagen fibers in there that makes it very, very, very strong. You can damage these if you have too much force on them. But in general, they are very, very resistant to pulling and other forces like that. Okay. All right. So it says, looking at the section provided by your instructor, that's this. Describe the structure and arrangement of different tissues in bone. Please include cortical bone, trabecular bone, articular cartilage, perosteum, tendon, ligament, yellow marrow in your answer. Please include any other terms you feel are appropriate and needed. Okay. In your lab sheets, it does have a nice diagram there showing a joint of that as well.